Hello and welcome to BOOBSBY Plastic Surgery Show. My name is Amadej Lah and welcome to my YouTube channel. Today we will be speaking about breast lift and augmentation and a little bit about breast reduction. I wanted to show you some photos to better illustrate everything, but due to YouTube guidelines, I'm afraid that it would stop our stream. So we have to improvise like in school. So welcome again and let's go with it. This will be the last broadcast about breast for a while, because I know that you're just tired of me speaking just about breast. We will be continuing tomorrow and in the next day with other body parts, with body surgery, with some other interesting things like skin conditions and some other things. So be ready for some other topics. So as I said before, today we are speaking about breast lift. It's a very similar procedure to breast augmentation. It involves, of course, usually breast implants, and what the part that is different from breast augmentation are some extra skin incisions, which help us to redistribute, to pull up the tissues and the skin, of course. So let me draw you something. I'm not a very good painter, but like I said before, we have to improvise. So if this is the chest wall and this is the breast before, and you put inside an implant is green. So this is the implant. What you get? You get a nice bigger boob. Yes? Okay, clear. Now the problem is in cases where there is too much skin, like this. So if we just put inside an implant, what happens? We get this. I mean, this is an extreme situation, but you see the implant will not fix this deformity. It will just make a nice fullness in the upper part, but the skin will still be hanging down. Of course, there are borderline cases where it's a little bit loose, let's say like this. So if we put green, yes, if we put inside an implant, it will fix the situation up to a certain level, but this is still not okay, because the nipple is looking downwards. But if we use a bigger implant, like this one, this is very big, it will solve the situation. So in borderline cases, we can use big implants to fix the ptotic, the hanging breast. But like I showed before, in bad cases, some other things need to be done. And that's what we're talking about now. So how do we do it? Well, if this is the breast, this is a normal breast that is not hanging. It's simple. If you put inside an implant, it's the same form, just bigger. Yeah. Okay. But if we have this, yeah. So this is the. Oops. We'll talk about asymmetries a little bit later. So if we have this, then an implant will not have, because it's the position of the nipple is too low. So what do? We need to do some extra incisions of the skin. Usually there are 4 types of skin incisions that can fix situations like this. First one is to incise just around the areola in the upper part and remove this part of skin. And when we close this together, it will pull up the nipple. So the result will be something like this. So you can see and the scar will be here. This is used in very few situations. This is a technique that doesn't work really well. So other options. So this doesn't work, or work in some just borderline situations. I just do it like this. So the other option for an incision is to go around like this, and one more incision here around the nipple. So when this is sutured here, this is sutured here, this is sutured here. So and we put all the sutures around, what happens? The wound will close and pull everything upwards because we removed more here than here. So what you get is this. Yeah. This is an option in also cases that are not really bad, where we need to leave the nipple just like maybe 2 centimeters, maybe 3, but no more. If we need to push it more, then we need the next procedure. The negative side of this is that when we do it, this side, after surgery, looks a little bit flat. If you look at your breast from the up down, it looks like this with the nipple here. Sometimes it's quite obvious, but usually if we are still we are not over exaggerating it or overdoing it, this works really well in in most borderline cases. So what about when we need to lift the breast even more? What do we do then? So this is the nipple. And this is the most common technique. We remove a circle like this, and we do something like this, and there's another incision around the areola. What happens? We pull this upward here, so we get the circle here inside of this upper part, and then we close this part. So what we get is this nipple and the scar. The scar will be around the nipple and vertical like this. This is called in English lollipop scar, and this is the most common way to lift the breast tissues. The fourth option I will just show here is when the situation is really bad, when the breast is hanging really low. So in those cases, we must add the horizontal incision, which looks like this. So like this, up and here. So the scar at the end will be like before, like the lollipop, with this part, with another scar inside the inframammary fold. So this is called anchor type of scar. So around the nipple, vertical and horizontal. So these are the ways, the techniques to lift the breast, and these are the scars. These are the types of scars. So one would be just semicircular, the other one would be periareolar, then lollipop, and the last one, like this one, anchor. Which is suitable for certain situation it depends on the surgeon. Usually the surgeon decides what kind of scar is best suited for a certain situation. I like to do more scars, because then the shape of the breast is much better. I prefer to get better shape with more scars than a bad shape with less scars. Because, nowadays these scars with a proper scar technique, scar management, are quite good. And you can check that on my Instagram profile. There are quite a few photos of before and after breast lift and augmentation, and also some examples of scars, and sometimes they're almost invisible. Now, the question, a very common question is, do you always have to use implants when you're doing breast lift? The answer is no, of course not. If there is enough tissue, enough breast tissue, enough fat or glandular tissue, you can use that to augment the upper part of the breast. So we would use the tissues from this lower part, do some magic on the inside to pull it up, and of course, using these tissues from the lower part, they will fill the part of the breast that we would otherwise fill with an implant. Sounds perfect, but an implant always gives you a better projection. An implant will stay high. So if you want round, high breast after breast lift, the technique with own tissues does not work really well because it always falls down a little bit, it sags. So in those cases, what can be done is or use some sort of an implant to fill this upper area, but it will make the breast bigger, which sometimes, of course, is not acceptable, especially in cases where the breast is already big. In those cases, we can do something that is quite controversial, but I like to do it a lot. It's called breast reduction and augmentation. So what we do, during this anchor type incisions, we remove a part of the own tissue in the lower part of the breast. So if this is the breast, usually very big, I would remove tissue here, then do the scars or do the incisions to pull up the nipple, the areola here, and then use an implant, green, to fill the breast back. And then, of course, using all these cuts, these incisions in the breast would remove this part of the this lower part of the breast where there is too much skin and too much tissue. So this is gone now at the end, and we get this. A nice natural shaped breast with an implant. Very common. So a very common question is, do you always need to use an implant? No, but if you want to have your breast up high, then yes, you should use an implant to make your breast higher up on the chest. The other very common question is, do you always need to correct the nipple or the areola? Of course, because it's too low. That's what breast lift is. If you don't correct it, if you don't move it upwards, it will stay too low. So, and your result will not be aesthetic. It will be just just a filled breast, filled in the upper part with these tissues in the lower part still hanging, like I showed you before. So it would be like this. So an implant here, but the breast still looking downwards. Not acceptable. So yes, to lift the breast, always we need to do some sort of incisions around the nipple to move it up. So the next question is, how do we know when to move or when to do breast lift and when just an augmentation will do? Well, there are of course extremes. Like I showed you the first, if there is chest and no tissue and an implant and then the nipple, of course, there's no need to do a breast lift. If you have a situation where the breast is empty and hanging like this, of course, we know that we need to do some sort of breast lift. But there are borderline cases. Those are quite difficult to judge because we do not know if an implant will fill the tissue or the breast enough to pull up the tissues. So like I showed you in the beginning, if you put a very big implant here, it will also fix the situation. But you don't want to have implants of, I don't know, 1 liter each size. That would fill, I mean, every skin, of course. So sometimes what we do a two-stage procedure. We we put inside an implant, do a breast just augmentation, and then we wait a few months. And then if we see that after a few months the result is not satisfactory, that it's still hanging, that it's still too low, then of course we do a secondary correction where we just move up the nipple, the areola, and fix the situation. So sometimes we have to do it two-stage. These sort of incisions are also very, very handful when we're dealing with breast asymmetries. So if we have one breast like this, one breast like this, we can use similar incisions on both sides, like I showed you before, like this and this. And of course, pulling this up, we will get the height of the nipple at the same position. It's not that simple because there can be other deformities, but it's a way to correct asymmetries. So